Actually, it's a great pleasure to introduce you to Jakob Teitelbaum. He's a senior associate at McKinsey in Montreal. He will be talking to us today about how innovation can save health systems, new models that are creating value in Canada and around the world. So as I already said, he's a senior associate at McKinsey in Montreal. He focuses basically on the healthcare sector, particularly in the areas of organizational change, lean productivity initiatives, and strategic planning. In addition to consulting, Jakob has been involved with a number of things. He recently led a year-long collaboration with the World Economic Forum. And they've issued a really amazing report. If you're interested in global health and healthcare initiatives and reform and innovations, I highly recommend to go to our website. There's a link to the report that basically Jakob has worked on in his description. So I'd highly recommend you to at the very least read over the executive summary. It's a really insightful report. So Jakob holds an MBA from INSEAD and a Bachelor's of Software Engineering from McGill University. So I'm really excited to hear his talk today. So please join me in welcoming Jakob.
Hi, everyone. Can you hear me without the microphone? Can I just talk? No. OK. Microphone. So the good news is that much of what I'm going to be talking to you about today is actually from the work that we did with the World Economic Forum. What I wanted to do over the next 15 minutes or so is try to take a bit of a step back, right? I think there have been a lot of discussions today around different topics. And each of those topics is part of the bigger picture, which is our national health system. And what McKinsey and the World Economic Forum did was we spent a year looking at the question of the financial sustainability of health systems at the national level. Okay. And I think this is important because each one of us is working on innovation in any given way. The purpose of events like today's exchange is to think about how these pieces fit into the bigger puzzle. Right? And it's all too easy to get really focused on your PhD thesis or your biotech project or your small startup business. I think one of the keys to making something truly have impact is to really understand how it fits into the dynamics of our healthcare system and how you can leverage that. So in a nutshell, where this work came out of is a trend which I personally think is one of the most important trends that exists, or at least that has existed, maybe it's this one, over the last 40 years. The charts are pitifully small, so I'm probably not, you can't really see much, but I'll explain it. The trend is just that healthcare is getting more expensive, right? It's no secret. Healthcare has been outgrowing economies in every developed country around the world, without exception, consistently for 40 years, which is a lot of momentum, right? So in every one of these countries, GDP is growing, and healthcare is growing 2% faster on average. And this has been going on for a long time. And it's only in the last few years that we've seen these two lines start to converge. And the reason for that is 2008, right? It's that healthcare is a public good, and governments pay for healthcare. And governments have less and less money, and so necessarily, healthcare costs are starting to have a collar on them, which is bad news, right? It's bad news because it means that you've got to spend less on healthcare, which means longer wait times or delisting of services. Or it means that you don't spend less on healthcare and you just spend less on other public goods, right? So we can spend less on education. The issue is that if you just kind of, what this, you can't see, but what it tells you is that if you just keep going, right? If you go to 2040 at this same trajectory that's been going on for the last 40 years, like in France, the healthcare spending as a percent of GDP doubles, which isn't going to happen because that's like the entire size of France's education sector, like roughly, right? And so the implication is that things are necessarily going to change. And they can either change the bad way, which is what I just described, or maybe they can change the good way. Okay? And so there's a few ideas about what, if you were the Minister of Health of Canada, or if you were the Ministre de Santé du Québec, like what would you do? Before we get to that, I think it's interesting to talk about why this is happening. Okay? a beautiful chart that you can't read, but it's in the report, and so I do encourage you to go have a look because it's actually kind of interesting. There's a lot of reasons why healthcare spending goes up. It can be helpful to try to make sense of it by thinking about supply and demand. Okay, so let's take a minute to stroke our beards, for the men, and think about why. Okay, so let's start with demand. There's a big piece of this which is well known to be an increasing burden of disease, right? So the baby boomers are getting older and there's aging populations, and so that leads to things like Alzheimer's, which is sad, and increased healthcare costs. And there's also an increasing burden of disease for other reasons, right? So with the advent of McDonald's, I think we're seeing more obesity and more diabetes than we used to, and these chronic diseases go on forever. Well, not forever, but they do take a much longer time to manage than back in the good old days when you got smallpox and either you were dead or you were better, and it was cheap either way. Right? And so the point here is that there's one driver, which is the growing burden of disease, which is visible, and which turns out to not represent the majority of the growth in healthcare costs. So it's part of it, okay? Another reason to do with demand, which is maybe less visible, is to think about our expectations and our behavior as consumers. Okay, so not the burden of disease, but how we behave. There's one thing which is our expectations of what we're going to get from the healthcare system. So Maslow's hierarchy of needs is something that we're climbing up, and our basic healthcare needs are now met. But we watch Grey's Anatomy and we see these like super complex, futuristic ways of doing microsurgery through a keyhole, which is going to test my baby's DNA without anything invasive. And those things are expensive, but we want them. Our expectations are going up. And hand in hand with that is, I think we would agree, generally a lack of value consciousness, right? Like, I don't have prostate cancer, I think. But if I did, I wouldn't really look at the bill. Like, I would just want them to do whatever it took to make me well again. And these are all on the demand side, right? And I could go on for a long time, so forgive me if I'm a bit too quick. But on the supply side, there are other factors at play too. Okay, so supply as in the delivery of healthcare service. So you've got one piece which is quite important around technological innovation, right? So innovation is one of the themes of today. And in many ways, innovation is an extremely good thing in healthcare, right? No one's going to deny that you would much rather have an expensive MRI than not have any MRI at all. So for sure, there's part of this cost growth which is very good. We can do much more than we used to. Now, there are many other industries that have also reinvented themselves through technology. And they've done so with like a 10-fold gain in efficiency, right? So if you think about how you go to the bank today, or how you go book a flight ticket, or you've never been in a steel mill probably, but if you do, I assure you, they're very different now. All of that has seen costs being driven down by innovation. Now, in healthcare, if you look at the mathematical correlation between patents or innovation by any other proxy, it actually explains a good chunk of healthcare cost growth. One hypothesis might be that for the past 30, 40 years, like, what have the incentives been to innovate, right? So let's say that I'm a guy of 20 years ago who's going to invent a better X-ray machine. And I can either invent one which gives you a slightly clearer picture, or I can invent one which has like about the same clarity, but it's like a third the price. I would posit that maybe in the past we've been rewarding value a bit less than we should have versus kind of the features. Okay, so I'm not quite sure to what extent that was true or is true, but my suspicion is that there's something there which is probably about right. The other piece which is probably important here is around the allocation of resources. Okay, so when I just said value versus features as an example, the problem is that value is an extremely hard thing to measure in healthcare. And a lot of you are nodding because anyone who's involved in healthcare has probably banged their head against the wall of value in healthcare in the past. And I don't think it's a nut that we have quite cracked yet, right? And there's been a lot of thinking about qualities and how is the best bang for your buck for your healthcare spend. But A, it's a really uncomfortable discussion to have, and B, it's extremely hard to measure. And so as a result, not only are we not able to allocate resources at the macro level, but it becomes kind of hard at the micro level. Like, I'm not sure that value creation is a thing that people talk about. In fact, I kind of know it. So in addition to consulting, I spent 2 years at Louis H. Lafontaine Hospital, and I was part of the management team there, and I was trying to drive change in the hospital to improve access to care and quality to care. And as a result, for 2 years, I was so Louis H., in case some of you don't know, which you probably don't, which is sad, is one of Canada's like 2 largest psychiatric hospitals, right? So it's near the Lafontaine Tunnel, and it's a huge part of our healthcare delivery network. And if you're a nurse in a hospital, there or elsewhere, what incentive do you have, let's say, to figure out how to minimize the number of needles you waste? Like, you're not really making a patient's life better because you notice that we're wasting needles unnecessarily. And it's not like someone's going to give you a check or necessarily even a pat on the back for having thought about ways to create value other than direct patient care. So there's this whole topic, and I'm starting to ramble, so I'm going to kind of keep going, right? But there's a topic around value in healthcare, which is going to come through this. So part of the work that we did during this 2-year thing with the World Economic Forum was to look at what seems to work. Okay? So if you were the Minister of Health, what should you do for the next 20 years to reach a sustainable health system? It appears that there are 7 things which are all important. And if you just do a couple, it does not work very well. Okay? So I'm not sure that I'm going to go through all of them, right? But there is something about being able to measure value effectively. There's an important piece around how do you create value consciousness in consumers, which is a bit of a euphemism, right? Because value consciousness, when you think about it, involves tough decisions for any one of us at a very tough moment in our lives. And part of it is will. So I could say, like, well, from now on, you're going to pay for your own healthcare, and that'll give you a damn good incentive. But instantly, you run into problems with equity. And it's not just the will part, it's the skill part, right? It's that if from all of a sudden you had to go shopping around for the right doctor, or I'm not sure that this colonoscopy is really going to be worth it, given that I only have a 0.3% chance of being diagnosed with something in time. Like, do you feel like you're equipped to be a value-conscious healthcare consumer? I don't think we've quite nailed that one yet either, right? And if I just kind of skip down here, because I think it goes hand in hand with it, prevention is another topic which has probably been covered today, right? If there's been much chat about healthcare. Because prevention is like the other half of care. The problem is that if I do have prostate cancer, the moment I'm diagnosed, there's a team of people who are on the hook to make me better. They are directly accountable for my treatment. Maybe I do have prostate cancer, I don't know, I have no clue. But part of why I don't know is because as far as I know, there's no one who is accountable for preventing me from having prostate cancer. There kind of is at the populational level, right? So for sure, governments think hard about this and try to invest in public health initiatives at a population level and to have GPs who are sort of there, but there's no owner of your wellness in the same way that there is an owner of your treatment. So China is one country which is really pushing towards having something called a health coach. So a person whose job is to keep you well. And there's I don't know if people know about this, but there's an old thing in China where for hundreds of years, you have a doctor and you only pay them when you don't get sick, right? So they do it completely the other way around. If you get sick, you go to your doctor and you're really mad and you say, treat me. And the doctor treats you and make you well and you don't give them any money. But the next time that you don't fall ill, then you do give them money, right? Which is in some ways maybe more effective than the way that we've got it now. There's maybe a happy medium, I'm not sure. Okay, so there's a couple of other pieces. I just want to be sensitive to the time that we have. I'm covering a lot of ground and there's more to come. A last example that I'm going to give is on little 3 that I skipped over. So number 7 is important but boring. Number 7 is, if you go to a Toyota plant, people are doing things really freaking efficiently, right? There are, like, the amount of work and thinking that has been done into efficient processes is staggering in the world. And many people have taken Toyota and gone, boom, and put it in a steel mill. Boom, like I'm doing it right now in a bank. Like I wish I were doing a healthcare project, but I'm not. I'm in a bank and I am helping them implement modern management and focus on performance. And I assure you, it's working better than the last time I tried to do it in a hospital. This is much harder to do for many reasons that we can chat about later in healthcare, but it's an important piece of the answer. Number 6 we talked about. Number 5 I'm about to talk about. Number 3, paying for value, okay? So a good example here is Kaiser Permanente, or even better, Valencia. Okay, so Valencia is a province of Spain. Instead of paying their doctors a fee for service, so instead of a certain number of dollars every time you do a diagnosis or a prescription, which as you can imagine is a bit of an incentive to increase volumes, they just say, you're getting 12,000 euros for Pablo for this year, and do whatever it takes to keep him well, but you're on the hook for all of it and for keeping him healthy. And there are a few places around the world that are really getting it right, this idea of integrated care, where not only do you have continuity of care in terms of the different providers, but you also have this like incentive that covers from prevention all the way through treatment. So think about all the stuff I'm saying, not just as interesting, but as how it applies to you, right? As a professional or as a citizen. Like, there's a lot of concepts that are very important that I personally believe are under-debated. And this is a hard debate to have because it's a bit sophisticated, but I think it's up to all of us to have these things discussed in a sort of public forum, and that's part of why we're here. The last thing that I wanted to briefly touch on, so the fifth one is about reinventing the delivery system, right? It's about new models of care. There are fundamentally new models where you book your flight tickets online, but a hospital kind of looks the way it used to. And they kind of run the same way they used to, and worse, hospitals are less relevant than they used to be. When you had smallpox, you needed it, right? You had epidemics and you needed infection control and you had acute diseases. But if you have diabetes, like I was saying, a hospital is maybe not necessarily the right thing for you. And so yet another part of what we did was we looked at examples of business model innovation from around the world in healthcare, okay? I'm gonna give you just 3 or 4 examples here. A first one, and again, think about how this could apply to our system or to what you do. So one play could be around specialization. So in India, there's a company called LifeSpring, which has really taken a hammer to specialization of maternity care. So they have created this like high throughput, no frills, super efficient and super reliable way to help women have babies. And as a result, they've managed not only to cut the cost of a delivery by a factor of 6, which is a lot, but as a result, they're able to expand the number of women who have access to assisted delivery dramatically, which saves a lot of lives, right? So there's one thing around specialization, and of course we think about how to specialize in our public sector and in private sector, but that's one important lever that it's interesting to see it at play elsewhere. A second one from Eastern Africa. So there's a Kenyan company called CFW Health Store. It's a franchise model. They have micro pharmacies and micro clinics that they just shoot out to franchisees, and now it's around in a few neighboring countries as well. And because they're doing it with a franchise model and not sort of the traditional approach, they're able to access a lot more marginalized populations than they otherwise would have been able to. So it's interesting to see people applying things like franchising to healthcare delivery as well. A third one is kind of like the info santé on steroids. So there's a company in Mexico called Medical, which has taken it a step further. The way that it works, it's a private company, is you pay a subscription, which I think is about $10 a month, and as a result, you can just call and talk to a doctor anytime. Like, the wait time is very short. Usually, a doctor picks up the phone and says, bueno, and you tell them your problem. And 2/3 of the time of that, your health problem is solved over the phone. And otherwise, they're gonna refer you the proper way. So Mexico is another country that, like us, has an issue with access to primary care. One of the ways that innovators are circumventing it is through low-cost delivery channels like a telephone, where it seems like you can really have 24 access to medical advice from a doctor in a way that's really cheap, and it's for the public good, because think about all these people, right, who called and they said, no necesitas ir al hospital, and as a result, they never went to the hospital, and the hospital was much less congested than it would have been. And it's good that we have things like Info Santé. I think this is an example of how someone else is doing it differently. A last example is PACS, right? So I think Canada can hold its head up high in terms of investing in the future of its health system at a national level in terms of diagnostic imaging. So this was a big play, and as a result, all of the remote populations that we've got across Canada are now getting diagnostic image results in half as long as they used to. And the recurrent savings are expected to be close to $1 billion. So I think this is a good example where you can see innovation not at the micro level in terms of business models, but in terms of the macro level of a country really putting its pants on and saying, this is an important investment in our future, and this makes sense in terms of quality of care and financial sustainability. So just to wrap up, right? I think that I've made the point pretty clearly, but let me say it one more time. This is an important problem because 40 years of momentum does not fix itself. And if it doesn't fix itself, it's gonna suck, because only one of 2 things will occur. Okay, the first thing that can occur is that we just do less. The wait times get even longer, and there will be even more articles in La Presse, and even fewer people will have access to the care they need in time. Worse yet, there might be some services that are delisted, right? So there have been a couple of countries in Europe that just hit the ceiling much faster than they expected to because of the 2008 crisis, and they were just like, nope, we just can't do elderly long-term care anymore. Like, we give up. And all of a sudden, there was a large number of people who thought they were being provided for and who suddenly weren't, right? It was home care for the elderly in a large chunk of Italy is a good example. So those consequences are really bad. And then the other consequences are also really bad, but I think they're a bit more insidious, and it's much of what we've seen in the past, right? It's that you do more. So if you're publicly funded and you're spending more and more of that budget on healthcare, then you're spending less and less of it on other public goods. And this makes us a less competitive country economically, but a less fun country to live in, and a less good country to live in. And then people are going to leave, and quality of life will go down. And the answer has to be to increase the productivity of our health system. Right? You can go look it up, but healthcare is a huge chunk of our budget. Like I forget, but I think it's like half of what Canada spends as a public budget. I could be totally wrong. And for the productivity to increase, it takes things like innovation and all the discussions that you guys have had today, but it takes people who are enlightened enough to think about the broader impact of what you're doing and how you can help solve the populational issues and not just your piece of the puzzle. So I encourage you to read the report if you want to think more about this. I'm sure you have a couple of questions, and so let's talk about it. Thank you.
So thank you, Jakob, for a really very interesting talk. Any questions from the audience? Okay, well, I have a quick one that I'm sure a lot of you are thinking. You mentioned and the report mentions the 40-year plan. How do you get politicians to think of the 40 years ahead when the elections are in 2 years from now?
That's a really good question, right? And so I think there's part of the answer, which is that you need to have a couple of bodies that don't have 2-year mandates, right? And so it exists, right? So the CBO, the Congressional Budget Office, is part of the US government, which is there to take the long view. And I think institutions like that can definitely help solve that problem. I think there's a second piece, which is to have this conversation up like front and center on the national level. Because if you're making short-term decisions like opening hospitals, but people are actually calling you on it and saying, is that really the right thing to be doing? Then maybe that'll reduce some of those incentives. And I think the third thing, which is very important, is to broaden the discussion. So there's like this idea of like the little health ecosystem, and people are like, oh, of course, there's like hospitals and insurers and pharma. But no, right, there's mayors, and there's Pepsi, and there's urban planners. There's all kinds of areas around healthcare that I think need to be part of the conversation. I think those three things probably help solve that problem.
Yeah.
Thank you, Jakob, for an excellent talk. I'm still digesting all the information, but one thing that kind of jumped out at me is this LifeSpring that you mentioned, the example. It's a really cool example. I didn't know about it. But I was just wondering, what's your opinion on kind of transplanting that idea to a healthcare such as in Canada? I mean, it's almost, the way you described it, it's almost like a factory-like setting. They were very highly efficient, you know? Yeah. Will people, with the level of healthcare they're used to, would they like that, or is it more almost a factory setting? It's a cultural shift. You have to change people to accept that you want to be quick and easy and out. And
yeah, I think that's right. It's a very big question, right, about kind of reverse offshoring. So there are countries that are being forced to do very frugal innovation because they're simply in a completely different cost environment. How do you bring that here without freaking people out that they're getting a lower quality of care is a question that a lot of people are trying to get right. Frankly, I'm surprised that there hasn't been more of it already. So when you go look at outcomes in some of these countries, like there are processes that are clearly more efficient, and you can see this in terms of a cheap MRI in the same way that you can see it as a cheap delivery unit. Your question about how do you make this happen more, I think is a good one. I'm afraid that I don't have a good answer to it. I'd be interested to hear anyone else's thoughts on this because it's a thorny question.
Well, unfortunately, we're out of time. I think Jakob will stay around afterwards for so you can address your questions personally to Jakob afterwards at the end of the conference. And well, again, if you're interested, again, talk to Jakob or go to our website, and the link to the full report is available. Thank you very much.
Thank you.